everyone, this is our EBP presentation and we're doing it on medication checks. My name is Maria.
I'm Savannah. I'm Jordy.
I'm Hannah.
I'm Melissa.
And I'm David.
So, evidence-based practice is a problem-solving approach that helps us make effective, timely, and appropriate clinical decisions in response to the broad political, professional, and societal forces present in today's healthcare environment.
Our target audience today are RNs from all over. That includes new RNs, RNs with patient overload, RNs in high-risk situations. They're the ones who are administering high-risk medications to our patients, and our goal is to reduce medication administration errors. We've got some importance on medication checks. That includes they are vital in ensuring patient safety and patient-centered care. It provides documentation for any kind of legal issues. It aids in maintaining correct standards of practice, and it ensures the 6 rights of medication administration.
So our PCOT question is, in patients receiving medications from nurses, what is the effect of 3 medication checks on preventing medication errors compared to not using 3 medication checks? So for implementation, the best way to implement practices, in order to ensure proper medication administration, it is vital to follow the 6 standards: right medication, right dose, right patient, right route, right time, and right documentation. Barriers to implementation include time constraints, heavy workload, burnout, look-alike, sound-alike medications, and shortage of staff. The timeline for implementation, practices can be implemented and improved immediately through way of PowerPoint presentation. We can offer a mandatory seminar meetings after the change of shift every Tuesday at 8 o'clock a.m. Okay, so barriers for implementation include time constraints, heavy workload, burnout, look-alike, sound-alike medications, and shortage of staff. We also have a timeline for implementation. Practices can be implemented and improved immediately, so we don't have to wait longer. They can already start now.
Okay, so now we're going to cover outcomes.
Okay, so what happens when medications are checked is drug use is a team activity, so no false assumptions are made. You're familiar with the adverse effects. Patient education is implemented. It minimizes patient harm, and patient education is effective. The goal of our outcomes is that medication errors will decrease after seminar training by 2 months after implementation.
Okay, so now I'm going to cover what happens when the med checks are not done. So first, the patient could be given the wrong dose. Second, the patient could be given the wrong medication. Third, the medication could be given at the wrong time. And lastly, the patient could be harmed and it may even lead to death.
Okay, so the first article we found was titled "Just What the Doctor Ordered." So it went and it compared the handwritten orders to the computerization physician orders, and the physicians are responsible for 50 to 61% of all medication errors. So the data collected was that with using computerization, medication errors are reduced.
The second article covers how your healthcare may kill you, and it's about medication errors. And so this study found that in the US, about 251,000 patients die from medication errors every year, and that's about 9.5% of annual death in the US. And it also showed that the US has a significantly greater amount of death as compared to other first world countries such as France, the UK, Germany, and Australia.
So for the third article, it mainly focuses on the value of precise patient identification. And so it mainly just describes the misidentification and its severe effects. And so this includes not correctly identifying the patient can lead to medication dosing errors and potential allergic reactions and several more.
And this is our works cited page.
And this concludes our presentation.
And thank you for watching.